I'm Dr. Kalpana Patel. I practice environmental medicine in Buffalo, New York at Environmental Health Center of Western New York. I'm a board certified environmental physician certified by the American Board of Environmental Medicine. I'm going to discuss the toxic mold syndrome. Toxic mold syndrome has become common in the present times due to moisture problems in the buildings and residential homes. As many buildings materials promote mold growth indoor is undesirable, unacceptable, and unhealthy. When mold growth is not controlled and becomes persistent, exposure can have many adverse health effects on human health. Outdoor air sample for mold survey are of less significance as our outdoor ventilation is plentiful. In human environmental interaction model, even when environmental exposures are subtoxic, but if they remain persistent and become multiple, it alters the body's signaling mechanism without killing cells. In other words, it alters the function of the cell. There are more than 100,000 fungi making up 25% of the biomass on Earth. All are not pathogenic molds. However, study published in Environmental Health Perspective in July of 2003 by Ray and colleagues have shown that in 13 molds in 100 patients who became sick with the toxic molds. Most common molds are Aspergillus, Penicillium, Alternaria, and Mucor. Stachybotrys chartarum is very important toxic mold, but it is less common. The presence of this mold doesn't indicate the presence of mycotoxin, as all strains of this particular mold does not produce the trichothiocin toxins. Toxic mold grow in any part of the building that is dark and damp. Toxins are released into the air, meaning that even those who are not in a close proximity to that mold can suffer from toxic mold syndrome. Mold particles are respirable and they carry mold spores and mycotoxins with them. And inhaled mycotoxins are 10 times more toxic than ingestible. Mold produces mycotoxins that are more than 100 mycotoxins. Even just one mold Aspergillus produces 60 or more toxins. There are 4 types of mycotoxins like aflatoxin, ochratoxin, rubratoxin, and ceterotoxin, which are very common. Mold and mycotoxins can spread beyond the actual area of mold infestation, meaning that toxic mycotoxin exposure can occur in areas of the building that actually doesn't contain mold, commonly seen in big office and government buildings, including school and big mansions. Mold frequently grows inside the walls and ceilings. Spores often end up within a ventilation system of entire house or the building. Adverse health effects are mediated by 3 different mechanisms: allergy, inflammation, and toxicity. Adverse health effects manifest in any and all organs, even in immunocompetent patients. They can vary from chronic rhinitis, chronic rhinosinusitis, asthma, intractable asthma, hypersensitive pneumonitis, and these are all common allergic manifestations. Allergic and inflammatory responses are the major causes of symptoms, but some symptoms may be from the toxic effects of molds and not from the traditional IgE or other immune mechanisms. Toxic mold symptoms manifest in any and all organs. Respiratory symptoms were detected in 64% of the patients in the study I reported earlier, which was published in Environmental Health Perspectives. Neurotoxicity, including neurological dysfunction, in 70% of patients. Neurocognitive functions in 50% of the patients, which varied from short-term memory loss, depression, panic, ADHD, ADD, and eating disorder, and including the problems with concentration. Also, I have seen executive function problem and then the judgment problems. Neurotoxicity may manifest as a peripheral neuropathy, sensory motor, or sensory motor in combination. Patient may suffer from headache, loss of concentration, blurry vision, double vision, etc. It is also very immunotoxic, and it alters the immune functions, and person may also develop autoimmunity, lower white cell count, T cells, B cells, even including the bone marrow suppression and thrombocytopenia, which may manifest as bruises and bleeding, and recurrent respiratory infections are common, and patients may develop the recurrent pneumonia, which is resistant to treatment with antibiotics. So, in summary, it can be mutagenic, carcinogenic, and dangerous to health if it is not controlled.